From We Run With You, I'm Kathy Wynn.
And I'm Rob Alvarez. This is Doing Good. This season, we interview brain aneurysm survivors and caregivers to learn how they are navigating new challenges and finding their own way of doing good.
Dr. Cherise Lathan has been pushing the boundaries for over a decade. She spearheaded the neuro PT residency and mentorship program at Keck Medicine of USC and is now exploring new therapy techniques at Medstar Washington Hospital Center while teaching at Georgetown and George Washington universities. Cherise holds a long list of credentials, but I will always remember her as the one who got me out of the hospital bed and gave me the hope that I could run again. Hi, Cherise.
Hi.
Thank you for joining us.
I'm so happy to be here.
Yeah, I am so excited because I have not gotten to see the best physical therapist in the world, and I'm not being biased at all. So I'm really excited for this day. So yay.
I'm very happy to be here.
It's been way too long.
I know.
So I wanted to actually start this podcast kind of from the beginning. So if you could tell us a little bit about your childhood, where did you grow up and how do you think your childhood influenced your career path?
Yeah, no worries. I've had a very funny and interesting childhood in that I've experienced both coasts. Born in Colonial, Massachusetts, and then moved from Colonial, Massachusetts to Southern California.
Different?
Very different, right? Went from, snowstorms to beach life. And that kind of dichotomy led me to want to go back to school in Boston. And that experience of undergrad in Boston, I had a roommate that unfortunately sustained a traumatic brain injury the summer before our senior year of school. And so we both actually came from the same town in California across the country. So there was a period of time where I was her only person that was able to be there for her, because it took a little bit of coordinating for her family. I spent the time in the ICU with her. I spent the time in the rehab hospital with her. And when I was an undergrad, I was always slated that I wanted to be an orthopedic surgeon. But that opportunity to be with my best friend and really see healthcare be consumed could do. And really, that's what led me to where I am now. I tried not to get into neurologic practice because I thought it would be too personal, but I ended up here anyway. So yeah, it was really that experience in undergrad that kind of shifted my gears from going down the physician route to being a doctor of physical therapy.
So do you think you knew then? Did that switch happen then? Or do you think was it further down the road, do you think?
It happened then, but it took a lot of self-reflection, right? Because regardless, PT, physician, nurse, we're highly motivated people. And so I had been telling people I was going to be a physician my whole life. So it took about 2 or 3 years for me to actually convince myself that I wasn't settling, that I was actually going after what my passion was. And I had to get okay with it, that I was going to kind of deviate from this plan that I formulated when I was 9 years old or something crazy like that. So, but it was definitely that experience. It was definitely, from my perspective, watching how the therapists really inundated and involved themselves in patient care, and really were the ones in the trenches, maximizing the outcomes, having to know all the bits and pieces and what to put together to return that person to what was meaningful to them. And by no means is that disregarding what the physician role is in it, but I just felt that landed more with me and resonated more with what I wanted to kind of set forth as my life path and what I wanted my impact to be on a human one-to-one capacity. And I'm so thankful for it because I actually love what I do.
And I'm very lucky as well. I'm glad that path was what you ended up choosing and you were happy with it. And by no means, you are definitely not, you did not settle at all. Cause I think you are tremendous at what you're doing. I may not have liked you so much at that time, but while you were trying to get me back to where I was,
Yeah.
But yes, looking back, always so fortunate.
We found times to laugh though.
Yeah.
So you said you, like from a young age, you knew you wanted to get into the medical field.
Yeah.
Well, was there something?
Oh,
Well,
I'm
what
a
was?
know-it-all, Rob. Come on.
What's that?
I'm a know-it-all. Like,
Oh, gotcha.
what other profession do you actually get to know it all? You know what I mean? And like
Yeah.
tell people, I think at one point my parents were like, maybe you should be a lawyer because you're so creative with your gift of gab and communication. Or, my dad was like, maybe you need to explore business because you're so good at like negotiating and sales. And I was like, healthcare, I get to do all of that. I get to negotiate with my patients. I get to know it all and convince other people and really, stand in this expertise. So it kind of was like a natural thing. People try to convince me otherwise, but I've always kind of been in that space of wanting to help people and be able to give a specific skill set to improve someone's quality of life. So it's weird. I've always been that little girl. I'm actually the only girl in my family too. So having to tell all the boys what to do and having to, have all my ducks in a row so they would like believe me or take me seriously. So I've been in training for a while.
Yeah, because I have to agree with your dad. I think whatever field you would have chosen, I think you would have been super successful. I had no doubts. But I think you're very good with, from what I know about you, you're very good with people and really deciphering what is underneath. And I think that would work out. That would also work very well as a lawyer, knowing people and knowing, what's behind what they say and, just really understanding what it is that they need versus what they might tell you. Or, so, what do you think it is about that pushes you to really get to know your patients and try to get to kind of either root cause or really what they need, and have that interest in to be able to provide that kind of next level of care for them, as opposed to just, well, here's what the books tell us you should do to get people through their rehabilitation.
Yeah, I think it's just, I've always been fascinated with like the philosophy and psychology of what it is to be a human being. And I think that takes me back to my undergrad. I went to a Jesuit university. And so we had to take philosophy, we had to take theology. And it necessarily wasn't rooted in Catholicism. It was really just understanding how human existence works. And really, it's all about having meaningful conversations so that we can connect to decide and decipher and prioritize, how you were going to create levels of intimacy in any type of relationship that you were going to have. And I think I really have pulled that forward into my practice as a therapist, and have also reconciled that with the science. Because even if you aren't in the neuro world or healthcare, we all know when it's your idea, you get more buy-in, right? When it's your own thoughts, you really subscribe to the process and, you have more accountability, you're more invested. And so I've always thought, how do I ask questions to get to know the person, to really identify what's the priority so that we together can define what that circle of intimacy is going to be in our own relationship. And with that patient-therapist rapport and that therapeutic alliance that we're trying to establish, it's really just me asking questions. And I think one thing my father always taught me is everybody at minimum wants you to know their name, right? Mm-hmm. And I think the more you ask questions, the more that person really feels as though you care. And you're not just another statistic, and you're really involved and engaged. And for me, it makes my job easy because you as the patient end up doing everything. I'm just asking questions, and you're coming up with ideas, and I'm like, let's try it this way. And I think that's what led me to be successful. And also that's what's in the literature. But I think it's just that curiosity of everybody has an interesting story. I think personally for me, that's why I don't do pediatrics, because I love working with older people or people that have had experiences. And it's really profound when someone's in such a vulnerable state to give them that experience of what normal was for them. Tell me about who you were, Yes, we are here in this hospital, or you are here in this bed, but who were you? What was important to you? What do you want to get back to? What was that like? Or, what was your craziest story? Or what types of things that are meaningful? And that just allows kind of the environment to escape the room. And you're really just two people having an experience together. And what can I give you to make you successful? And in turn, you sharing is like, oh my gosh, that's such a really cool experience. And I'm just learning more about just being a human on this planet. And we're all trying to make each other better in some way. So that's been really cool to experience. And like I said, it's really just asking questions and me being nosy, and it makes my job easy. It makes it fun.
So I wanted to go back to so after undergrad, once you've decided, okay, this is the path that I wanted to take, physical therapy, where did that land you next, or where did you go next?
I have what I call a 22-year-old crisis. And the 22-year-old crisis for me was that my parents were like, we're done. You're off payroll. And whatever you do next is on you. And I freaked out, rightfully so. It actually took a sabbatical in a way, which I think today's generation would call a gap year. But my parents only gave me, I think they gave me 2.5 months. And I actually chose to go to Ghana. And I went to Ghana and ran a computer camp in a really small rural community. And I think just stripping away everything and recognizing that the world's not a really big place. And even though I may not know everything, I have something to offer other people. Again, just really helped me like prioritize, okay, this is what I want to do. And then when I got back and started looking at kind of rewriting my path, because I had done the pre-med thing, I had taken the MCAT, I didn't take the GRE. So there were things that I had to do to realign to apply for physical therapy school. And so on that journey, I also reconciled that my parents were done with me. So I had to get a job. And I actually landed in pharmaceutical sales, kind of on the biotech side. So that allowed me at that time period, I mean, we're talking early 2000s, where us young people were making way too much money, doing absolutely nothing besides talking to people, allowed me the space to really do some prerequisite work, to do some volunteer hours, to make sure that this is exactly what I wanted to do. So I volunteered in a PT clinic. I also continued to volunteer in a physician's office just to make sure that I was 100% convinced. And again, I think that helped me, and that might be why I'm able to interact with my patients in such a different way, is because I was doing inside and then outside sales in the pharmaceutical world, and learning how to qualify your customer and ask questions and identify what their needs were so that you could meet that need. It was definitely a skill set that I was able to develop. And then I also had the opportunity, they were trying to get me to not leave. So they sent me over to Italy to open up an international office over in Italy. And I think that experience of kind of being a fish out of water, where I thought I spoke Italian, but I actually didn't, and having to communicate and being in an international space, first time traveling internationally alone. Because even when I went to Ghana, I was with a group of other students. So it just really got me to grow up and really be like, okay, I'm in the right space, and this is what I wanted to do. And I put all my eggs in one basket. I only applied to one PT school, which was the University of Southern California. And I was like, go big or go home. At the time, we were the #1 program in the country, and I just went for it. And my parents have always told me when things are meant to be, things fall in place, and everything just fell in place. And since then, everything's just kind of been easy and it's been fun, which I'm so blessed and thankful for.
So what was that experience like at USC for you?
It was interesting. And it was interesting because I was an old person. Most people in the physical therapy profession, they take a direct path, right? So at 22, they're finishing grad or undergrad, and they're going directly into grad school. So me as a 26-year-old at the time, having completely different experiences, not only from a financial standpoint, but living internationally multiple times. I just felt like I was in school with people that were on a different maturity level than I was, which made it really difficult. It was very isolating. I owned a home at the time in Los Angeles, and they all were, cohabitating and partying with each other. And I was like, I was just like, I'm here to study. I'm here to get grades. I'm here to take advantage of every opportunity. But again, I'm thankful for that experience because, again, that was another challenge on how do you relate to different people. I'm walking a different path. I have different priorities, but I had to figure out, these are my classmates. We're going to have to work together. It's a manual skill. I have to have somebody to practice with. I need a study group. So not that I wanted everybody to like me, but, how do you kind of break down those barriers so I wasn't perceived as kind of the auntie in the group, and they would be vulnerable or come to me for help, or I could go to them for help. And again, it was another data point on my journey of, making me the clinician that I am now. So PT school was very, very interesting. I definitely had my claim to fame because in my pharmaceutical time, that was of the paparazzi era with like Lindsay Lohan and Britney Spears in the clubs. And, I knew the bartenders and the door guys. So they'd be like, Cherise, can you get us in? So I definitely used that to my advantage to kind of relate to them. But then I was like, it's midnight, guys. It's kind of late. It was interesting, but it was cool. It was very fun. Some of my best friends, I found during that time, and we're still very, very close, which I think is a cool experience to create kind of those adult relationships. And it's been neat to watch people grow into their different areas of expertise. And we also kind of come back together, which is fun. But PT school was interesting. It was challenging, not just academically, but just socially, and in that life moment where some of my other friends are, marrying and having kids, and I'm hanging out with 22-year-olds and trying to reconcile all that. So it was a weird time.
All the traveling and experiencing the different cultures. How do you think or do you think there are times where you pull from those experiences in your work now?
Totally. So I think when you can get outside yourself, you realize that we're all the same, right? And I think it's so interesting that no matter what culture you come from, fundamentally, we're all kitchen people. Everything in the family happens in the kitchen, right? And so, there might be different nuances to it, but you can always find a point of relation to get someone to put their guard down, to share with you, by just finding this human aspect of family and culture. And it's so funny to me that it always comes back to food and always comes back to the kitchen. It's either an experience with your mother, your grandmother, your aunt, your dad, somebody, and a conversation you had at the dinner table, an experience you had in the actual kitchen. And it's so cool to be like, oh yeah, when I was in Italy, someone's nonna taught me how to make a ravioli. And they're like, oh, really? And I'm like, yeah. Or even like between African-American and Asian culture, I'm like, Black people eat chitlins, Asians eat tripe. And we can share, like have this conversation And it's like the second you like kind of like, they're like, oh, you get me, you understand me. This mask kind of falls, and you can really get to the nitty gritty and connect with your patient. And then they're telling you things and divulging information that they might not have shared. You're like, maybe you should share that with the physician. Maybe that's why your blood pressure is so high, friend. And just trying to help with that advocacy. And so I absolutely pull those cultural experiences in, because we're all humans at the end of the day, and it's just so cool and so interesting that no matter where we come from, I'm telling you, you should try it. Everybody has a story that's like foundational, and it occurred in the kitchen, at the dinner table, or over a plate of food. Always.
We're gonna have to try that on our next trip when we see a group of people and we're like, so what you guys eat last night?
Yeah.
Good icebreaker.
Yep.
So I guess fast forward to 2015 when we met you and we got to meet you.
Yeah.
You got to meet Kathy for the first time
Yeah.
in the ICU at Keck Hospital.
No, but before, really quickly. So before we met you in 2015, so let's just say, can you tell us at that point, by 2015, where were you at in terms of your position? How many years were you at USC?
Yes. So I graduated the PT program in 2010 and then immediately went into a residency program because I knew I wanted to do neuro. And I wanted that advanced certification to be board certified in neurologic practice. And so that program I specifically did was at USC and also with Rancho Los Amigos. Because traditionally, from a consumer standpoint, people understand or experience physical therapy either on an outpatient basis in relation to sports or, something you're consuming in the community, or there's a relative understanding of like rehabilitation hospitals, right? Where you go. But even in my journey and my education, there was very limited awareness and exposure that I had to acute care or critical care practice. And so interestingly, at the end of my residency, I was exploring opportunities to stay on at Rancho Los Amigos, which is a rehabilitation hospital. When I was approached by a colleague of mine that was like, wow, there's an opportunity to come on as clinical faculty at USC where you can continue to teach in the DPT program with the students. But then also we're starting to kind of increase our footprint in acute care and particularly in ICU practice. And I just thought it was a phenomenal opportunity to be an educator. I was always very interested in that, and to learn a new skill and to kind of do a lot of program development and advocacy for the profession in a space that I was unaware of even as a student of physical therapy and a resident. So I joined the faculty in 2011 and really created the neuro program that you got to experience, Kathy and Rob.
See how much you would have missed out if I didn't take like two steps back.
You should ask the questions.
Yeah. So I definitely worked to recruit other clinicians. And it just so happened we had a very natural pipeline from our physical therapy student program. And then at USC, a part of our education is we do 52 weeks of clinical education throughout the 3-year doctoral program. So what that essentially worked out was usually in the end of the 3rd year, the students do a 4-month clinical rotation. So I was able to start enrolling students to sit with me and be mentored by me for 4 months. And my practice was exclusively in the ICU and the neuro unit at the 7 North, which was the step-down unit, that allowed me to kind of work with the neurologist to get to know the surgeons and the surgical residents. and really kind of step into the space of what an academic medical center could and should be, by really being this forward-facing physical therapist that was developing expertise in medical procedures and educating the physicians, whether the neurologists or the surgeons, on kind of what the role could be for a physical therapist in the acute care setting. And we got to experiment and really kind of divulge into this academic experience together. And it kind of just grew. I went from a team of 1 to a team of 3. And I think by the time I left in 2018, we were a team of 8. And it's really cool. I still call back and I still hear from like Dr. Russin and Dr. Mack on the great work that they're still doing with the PT department there. So it was a really phenomenal opportunity to really kind of create this niche practice. And then that's why I kind of came across the country to DC to start replicating that, and how can we make this bigger and more impactful in different medical systems, because we really saw the fruits of our labor. You know, you guys definitely in your patient case, Kathy, in your experience, being able to really give that expertise and that specificity on what can neuro rehab look like from the beginning, not 3, 4, 5, 8 weeks out where you've just been laying in bed or maybe getting up out of bed into a chair, but how are we really pushing the envelope in the ICU and collaborating with the surgeons so that we have optimal outcomes.
Well, I have to say that, I mean, I think you've forged the blueprint, of what, rehab and PT should look like. And, I mean, the least I can say is I'm just grateful that I was right there in the thick of it. And yeah, DC has gotten they caught a really great superstar on their end.
Thanks.
Yeah.
Thank you.
All right, now you can answer Rob's initial question.
What was that question? Remind me, Rob.
Yeah, but I was that's interesting, because I guess thinking about it, I just thought all that has been in place like forever,
Mhm.
But I knew at the time, it felt, at least at the time, that this was different, like the care. Well, first of all, I didn't expect to see, you, like, it was, I think the day after she woke up from her surgery, I was like, it was like a Saturday.
What are you doing?
I was like, I see you and you're like, all right, let's get her up. I was like, what?
What?
She's had brain surgery
Right.
like 2 days ago, and then
Yeah.
just woke up yesterday.
Yeah.
So, but it felt different and special. But that was kind of what I come to expect in that week, in Keck Hospital. That this is a different place.
Yeah.
But so I guess you giving a little bit of that background helps me a lot. Like, helps me understand, and I think one thing I didn't realize was that none of this is really in place in a lot of places, right? So it's great that you are spreading it, and you've created, you've started to build it in at USC, and it's starting to get gaining momentum, and you left a great legacy there, and now starting that over here in the East Coast. So
it's been fun. It's had its challenges, definitely, because it takes a lot of enrolling of the physicians and even the patients and the families, because cognitively, you're, like you said, my wife just had brain surgery an hour ago. What are you talking about? But it's just really stepping into the full scope of our practice as doctors of physical therapy, and us being able to advocate that we understand the medical implications and what to monitor. We are the experts in movement. We are the experts in exercise. And then particularly within neurologic practice, really trying to bring that the neuroscience into it. And it's just as simple as use it or lose it, right? And, just thinking, even you, Kathy, with your training, if you're going to run a 100-meter sprint, you don't just train 100 meters, right? You're running 5s, 4s, right? To really prime your body for this optimal performance. And so it's how can you pull that into this critical care environment in the ICU, and contribute to improved outcomes. So it's been really cool to kind of take that and run with it. But it's had its bumps in the roads. It does take some enrolling and lots of convincing. I think Johns Hopkins does a great job of it. They've done a lot of work with it. TIR down in Houston does a lot of work with it. Certainly Shirley Ryan in Northwestern in Chicago, they do a lot of great work with it. So it was really cool to pull that into Keck, which is not a trauma center, but it's an academic center. And to really engage people in conversations and contribute to the body of literature to start changing culture. So that was really cool. So I'm trying to pull that over into a different health system now that's affiliated with a trauma center, and it certainly had its challenges. And I definitely get looked at crazy a lot, but I'm like, trust me. But everything comes with time.
Yeah.
So I guess my question originally was to try to, I guess, understand, what was your approach with Kathy? What was your experience and when you first met her and us, I guess?
I knew that she was young. She had 2 adorable twins. And Rob, you shared with me that she was an ultra marathoner. And that was the first time I had ever heard that. You're like, yeah, when she turned 40, she ran 40 miles. I'm like, what? What? So I knew I had an athlete on my hands. And that was my priority, was to treat her like an athlete, was to identify, set a goal, set a challenging goal, which I knew would irritate her enough to motivate her to push herself. If it was too simple, she would have been bored, and she would have blown me off. So I knew I had to dangle a carrot that would motivate her. And so we're running. And I remember she was like, what? I was like, we're running. Come on. I got the pole. Go. I was like, you ran 40 miles X amount of months ago. Come on, let's go. And I remember Kathy looking at me like I was a lunatic, but I really think me setting that challenge that was right for her, and then allowing her to participate and did that feel different? What do you want to do differently? How does your stride feel? Or how is your breathing? Or what are you experiencing in your body? And just giving her tweaks and really collaborating with her. I really think we saw her go leaps and bounds where that first day, just trying to get her to sit at the edge of the bed and hold her head up and kind of engage her upper body and trunk to, I remember us running up and down the hallways and standing at the wall and doing timed marches and trying to get her heart rate up. That's not hard enough, Cherise. I'm like, okay, keep going. It was really fun. I remember Dr. Russin looking at me like I was a lunatic. He's like, what are you doing with my patient? I was like, I got it. Settle down.
So he was advocating for me.
He was like, Cherise, you're going a little far. I was like, no, I'm not. She is an athlete. I was like, trust me. I'm like, I'm monitoring everything. If anything is weird, we'll catch it. So we had lots of spirited conversations about you, Kathy, certainly. But I think even so, that allowed us to start talking about what was important to you. And I remember one Saturday morning, it was the day of the LA Marathon. And us just, like, oh, I wish I could be out there. And I was like, then do it. And then you're like, I'll only do it if you do it. And I was like, okay. And then that really started, okay, how do we break this down? What does the training program look like? What do we have to align? Dr. Russin, this is her goal. What are the checks that we need to put in place from a medical perspective so that in a year's time, she's actually going to be able to do that? And us really kind of breaking that down, I really think gave you that task and that goal, that carrot to chase. And it got everybody enrolled in getting Kathy back to being Kathy. And I think it was important for your kids to see you being you. And it didn't look different, didn't feel different. And I think, oh my gosh, at their age, I don't know, they seem so grown now, which is freaking me out, by the way.
I know.
I cannot believe they're going to college this week. But I think at their age, just being able to see their mom, be their mom. And she didn't look like a patient, even though she had a gown and a hat on and a crazy half-shaven head. I think that it was just important to kind of get everybody on the same page of Kathy is going to run a marathon. in 2016. We're all doing it. We're all subscribed to the goal. We're all enrolled in the goal, and let's go.
Yeah. Well, it's my memory is still very faint of all the let's just say
the laps you did in there.
the program that you put me
Oh,
on, but I do, and I just want to share this story because I think the listeners will probably get a little giggle out of it. But I do recall that I don't know how many times you may have thought I was trying to ditch you, but I think at least 2 times. But I do remember one session vividly where I knew you were going to come, and I was ready for it. And then I think, I don't know, correct me if I'm wrong, but I think when just as you were about to come into my room, I was like, all right, just give me a minute. I don't feel good right now. And I think I was just having like a really bad, like really severe headache at that moment.
Mhm.
And I think as I was about to get up and get ready, because I was pumped. I was pumped to
Mhm.
do a little bit more marching down the hallways and
Mhm.
all that. But by the way, I did think you were crazy too. I was like, does this
What is
lady
she doing?
know what I just had? Like, I think I was even thinking to myself, I'm like, am I crazy? I thought someone told me I had a craniotomy done, and she's making me what? So, but anyways, back to that story. I do remember, I think once I got up, I just like fell into like a pile of coal. And I
Yep.
think I had to get rushed to get
Yep.
another scan done.
Yep.
And I was thinking the whole time, I was like, oh my God, I have a feeling Cherise thinks I'm like faking this so I don't
Oh
have
my
to
gosh,
go through
no.
therapy with her to PT with her. So I'm
Not.
sorry, but it
Oh my
wasn't.
gosh, Kathy. Not at all. I mean, I hope I handled it gracefully in the moment, but that was terrifying. That was absolutely terrifying. I remember it vividly too. You did have a headache and you're like, no, I want to try. And I was like, no, Kathy, I can come back. And when you got up, you just fell into my arms. And that luckily you are so beautifully petite that I was just able to levitate you back in the bed. But yeah, no, God, no. I never thought you were trying to ditch me. Or
I just want to set that straight that I wasn't.
there was one
wasn't
time I
trying to
remember
get out
us.
of it.
There was one time I remember us at the end of the hallway at one of the windows, and you're like, "Are we done?" I was like, "No, Kathy, you got 10 more minutes." You're like, "Oh God." So that time maybe, but definitely not that time. Not that time. So I would never think that, and also I would never let you get away with it.
That was just funny though. I just wanted to share that memory, which is quite, for some reason I hold it pretty dear to my heart. I'm like, she's there to get me back to where I should be and where I want it to be. And the next thing I know, I was gone. I was out.
Mm-hmm.
I think the next day or two, we got back to it, right?
We did.
Yeah,
We
you got
did.
back to it. Yep.
We
Yeah, I
did.
think pretty quickly. Yeah.
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 So you did mention you guys, I guess I didn't realize you guys were hatching the plan already that week for LA Marathon 2016. And
Yeah.
you ran it with us, along with,
I
a
finished.
few others. Um,
I finished.
you did great. I guess what was it that made you decide to do that with us?
Mm-hmm.
I don't think I had a choice not to.
Mm.
From my memory, when we were talking about it, Kathy immediately was like, "If I'm doing it, you're doing it." And I was like, "Okay, lady," because I was like, "Okay, I'm totally gonna get away with this." She is here visiting family, but she lives in Delaware. So when this is all over, Kathy's gonna go back to Delaware, and there's no way this is happening. So I was like, "Sure, I'll run it with you." And then I just really think, like I said, it like we spent time, meaningful quality time together, and got to know each other, and forged a relationship that, yes, it was rooted in your rehabilitation, but we had this human experience together where it was important for me to show up for you, because I wanted you to have that success, because I knew you could do it. So I just challenged myself to do the training, and was lucky to run that year when it was 100 and ridiculous degrees at
So
5 a.m. that they had to push the start time up. And, I think particularly too, just from a competitive standpoint, the fact that Dr. Russin was going to do it, and Joe Hendricks, the PA, was going to do it as well. We all definitely held each other accountable to training, with the exception of Dr. Russin, which is so annoying to me because he didn't train at all, and then ended up being this like amazing runner and eventual triathlete. And I'm like out in Manhattan Beach every weekend, like doing this whole training plan and dying. So yeah, I felt like there was no choice, and I felt like I wanted to show up for you because it was important. It was important. And it was a shared experience that we had.
Yeah. No, that meant, I mean, gosh, that's, well, I've ran a lot of marathons, but that was, that's next to my rewriting my story on March 8th of 2020, which was exactly 5 years from my ruptured aneurysm. That was probably one of the best, marathons ever. And I think it's not, well, of course, because it was my comeback. I call it my comeback. But I mean, for me, it was just so important because I wanted to show everyone at Keck, especially, you know how I feel about 7 South, the medical staff, I call them my team, my angels, team amazing, hashtag team amazing. And and all the neurosurgeons, and of course, that that I'm here because of all of you. What a better way for me, that was how I wanted to say thank you. And then for you, and then Dr. Russin and Joe and countless other admin staff running their first marathons. I was like, holy cow, this is just incredible. Like, how committed are they to their patients that they will show up like that? I mean, I don't think I don't think many people would. They're like, yeah, let me take you up on that offer to just run the last few miles with you. But no, not Keck Medicine of USC, So for me, that was just so important to do. And to come back and do that in LA. And how it was, it was February 14th, which is like even more memorable because it was Valentine. It's like, we are. But I just wanted to say how, gosh, I was just so taken aback by the kindness that everyone showed me. That's, I mean, if you don't call that love, I don't know what is. That was just such a beautiful, beautiful day for me. It was just, I can relive it every day, and it'll always bring a smile to my face. And I was so proud of you too. And you kept going after that in terms of, you're saying, yes, you finished it. No, you ran a marathon. You are a marathoner. You are one of the 1% of, people in the world that would ever do something like that. But I was so incredibly proud of you too, because you just continued on this journey of not only being all right, you let's just say you're a pretty badass PT, but you challenge yourself even more doing all these CrossFit training. And I was like, see, this girl does not do CrossFit. Okay. I will run, I will bike, I will swim, but
Yeah.
CrossFit, that's really tough. That's mentally, that's mental toughness that you need. And so yeah, as I saw you through your journey, your fitness journey, I was like, wow, she's pretty incredible. She's got it
Aw,
all. You know, she's smart, she's
thanks.
athletic, and you have such a kind heart. And even though I did not need your, let's say, help with getting back to where I am, I love the fact that you would still answer my text like, Cherise, I don't know why my knee is acting this way or my hips. And, and then you would give me a regimented or send me videos or links to what I should do. And by the way, I did follow it. I do still have them all. So I refer to it. But yeah, you're not just a PT at that moment. You're a PT for me, like throughout my whole life. So that means so much to me. So thank you.
Aw, that's so kind.
So we've talked with so many survivors that struggle to to find good rehabilitation or therapy, or and not to mention good, but also even affordable, right?
Mhm.
For many out there.
Right.
So
Right.
I think this is a great area to focus on, and I think what you're focusing on in spreading the capability to different places all around
Yeah.
the world, I think is important. Kind of one step at a time, we build this out. So
Right.
yeah, you've definitely played a big role in kind of where we are now.
Yeah, definitely. Because I think a lot of survivors that we've spoken to, I think once they were, I mean, even before they were released or discharged from the hospital, I don't even think they had any PT.
Right.
So that the fact that you, and I'm so glad that you told them, look, listen to me. I know what I'm doing. They can handle it. We're here to monitor, and we're here to make sure that they're going to be back at least as close as they can. Because I think even though I may have still been weak, when I got home back to Delaware, I think at least having that few days or weeks of physical therapy, at least it woke up some of my muscles, the lack of muscle that I had, but whatever, at least it re-energized it. And I think that helped a lot. And so yeah, I think as far as where you're going, as far as implementing getting this blueprint to other places that you're at, I think it's tremendous. I think it's a needed cause, especially it's a needed, let's just say, prescription for a survivor, because
Absolutely.
I think for me it certainly helped guide me through when I went back home and wanted to at least walk or try to jog or run again. The muscle memory was there, but I think after a while, if I never did get that PT, and when you go home, I don't even think I would have even thought about getting PT had it not been knowing that, okay, I need to continue this. Because you're at a point where, as from a survivor standpoint, when you come back, well, for me, when I came back home, those last, week or so without any PT, it got me to kind of coil up again, because I was in so much pain. You're not given the, the amount of medication that you would normally get at the hospital where people are monitoring you. So prescription is less. So of course the pain is there, but the fact that I knew I can do it, I was like, gosh, I think I was like marching or walking the day after my surgery. So I should be able to do this.
Yeah.
And yeah, so it's for me, I'm just grateful that you were there, your program was there, and you pushed me through it, even though I'm pretty sure I complained a lot. I've been known to complain a
That's
lot.
okay.
I will do it, but I will make it scream during.
I'm very similar, but yeah, I think it's important. And I always say this to my students too, like, don't let the environment dictate how you show up. And I think in the world, we know the benefits of exercise. So why, because you're in the hospital, we abandon kind of the restorative or the rehabilitative or even the mental health qualities that come from movement. And it's just you having to have the person there with that level of expertise that knows how to dose it or to create an environment for you that it can be safe. And in your situation, that environment was high intensity activity because that's what your muscle memory was. So just really tapping into that and then using all of the benefits that we all know from exercise, and not letting the environment kind of dictate what that looks like, manipulating it to your advantage. Because really, at the end of the day, it's about the patient, it's about their outcomes. So how can I help you be successful?
Yeah.
Cherise, what advice do you have for patients out there going through kind of similar to what Kathy was going through, in their initial days of recovery and rehabilitation?
Yeah, I think advice to patients is just trying to be okay not being okay, and allowing people to show up for you. I find I have the hardest time with my patients that I don't want to say are struggling with acceptance, but are kind of creating their own barriers. So I would say from a patient perspective, ask questions, certainly, but trust the expertise that's around you to be able to kind of create this plan of care for you. I would say most of my advice comes for the family or the caregivers in advocating for your loved one to get out of bed. Trust me, there are many times where I get people out of bed that are still on breathing machines, that are still hooked up to tree branches of IV medications and whatnot. There's just something very, there's just something that happens when you interact with another human, not lying down. So even just sitting up, and even if I have to hold your chest up and hold your head up, but just being able to interact with somebody, it's something clicks. And so I really always advise anybody that's experiencing having a loved one in the critical care environment, advocate for them to have therapy, advocate for them to be out of bed. Be engaged and be involved. What can I do? You're not here all day. I'm going to be here more than you. Teach me one thing that I can do. Talk to them like you would at the dinner table. I always laugh, and I don't know if you remember, Kathy, I make fun of Dr. Russin and Dr. Emanuel because they would go in their patients' rooms. They would shout. And I'm like, what are you shouting for? There's nothing wrong with their hearing. Yes, they had a brain surgery or something, but they could hear. Please stop shouting. So that's one thing. I'm like, just talk to them normal. So that's a lot of my advice is for just advocating for mobility. And then just how do you support your loved one or the patient to kind of let their guard down, to let people help them. So that they can kind of move forward in the process.
Yeah, that's great advice. And back to that no shouting. Do you remember I had very sensitive hearing? I don't know if it was in the hospital, but
It was.
it was so, I was
And
very,
lights too.
yeah, I was super sensitive to
Mhm.
noise, particularly like
Mhm.
that phrase, you can hear a pin drop. That was me.
Mhm.
Yeah.
Mhm.
So yeah, I did not appreciate the shouting.
Sure. What are you shouting for? It's very interesting. I don't know why we do that, but we all do it. And I'm like, why are you shouting?
That's so funny. So, what are you, I guess, focused now in in this stage of your career? Is there anything new you're
Yeah.
setting up
I
there? Or-
mean, I wear multiple hats now. So I manage a team of therapists now. So I do less patient care, unfortunately, and more, management and administration, and trying to have a larger impact from like a policy perspective within our healthcare system. But clinically, I'm still mentoring residents. And I have one resident that I work with, and we're working on this really cool project on bringing virtual reality into the ICU and critical care. So one thing that we do know about motor learning or learning is that when there's specificity, it has a deeper impact with us, right? So how can we use virtual reality if I talk to the family and can create a sketch of that patient's bedroom or that patient's home, so that they start moving in environments that are salient to them, as opposed to this artificial hospital sterile environment that has no context to them. They know where their kitchen table is and how do they have to navigate and move in their home. So starting to bring that into the critical care environment for dual purposes. One is when people are too sick to get out of bed, how can we kind of give them this aspect of mental practice or imagery, which we know is so huge in the sports world. I mean, Kobe Bryant speaks to it all the time on how he would close his eyes and imagine how he would perform in games, and then it would come to fruition. So bringing that into the ICU and neuro rehab, but then also getting patients up out of bed and being able to use equipment. So I've been using a lot of like portable treadmills, bringing them to the bedside, and overhead harnesses for safety standpoint. So people can start navigating and walking or even running kind of at the bedside. But again, they're having this visual input of like, I could put Kathy on an old race trail that she knew. And so that muscle memory just kind of kicks in. So we've been working on that and trying to bring that in, which has been really fun. A little bit derailed by the pandemic, certainly, as priorities had to shift. But that's kind of where I've been going, and still working on educating with PT neuro residents that come through our program, and working with them from that aspect. So it's been cool.
Yeah, that is so cool.
That's so smart too. That's really smart. Now, forgive us, but did we ever mention where you are at? So
Currently,
currently, I don't think we did.
we did it. We did it.
So that if there's anyone that wants to pick Dr. Cherise Lathan wonderfully gifted brain, they can find you, or of course they can connect with you at the handle there.
Yeah. So I'm currently practicing at Medstar Washington Hospital Center, which is the level 1 trauma center in Washington, D.C. Like I said, I wear lots of hats. I'm also a clinical associate professor at Georgetown. I'm an adjunct professor at George Washington University in their PT program. And then I'm the director of the physical therapy neurologic residency program here in DC. So there's lots of ways to connect. Of course, send me a DM on my Dr. Cherise handle, or my email is just my first and my last name at gmail.com. So I'm always happy to share any ideas or give any referrals or connections, because this neurologic PT world of ours is pretty small. So if I may not know, I certainly know somebody that could help. So I'm always happy to entertain any questions or facilitate any networking that would be helpful for anybody. That's never an issue.
Yeah, you sound really busy.
You know,
But yeah, and it's
why
awesome.
not?
Yeah, I mean, I shouldn't have not had any doubts that you continue to break down barriers. But
Yeah.
introducing all these new techniques and just opening up people to new ways of doing things, right? And always advancing
Yeah.
treatment for patients. So that is incredible.
Yeah.
Is there, before we end, is there any areas you wanted to talk about that we didn't get to, or any questions?
No, I mean, my mantra is always believe in the impossible. So I think even for if there are any other future therapists or clinicians that listen to this, just continuing to ask questions and be inquisitive and push the boundaries. And then likewise for any patient or family member that might have to be consuming the expertise due to a brain injury or an aneurysm, just believing in the impossible. And really believing that your care team is there for you. So as hard as we will show up how you lead us to show up. And so you as the patient, the family, the caregiver, if you create the space, your care team will fill it and we will show up for you. And I think that's the experience that Kathy, you and I and Rob and the kids had, is that there was a space for me to show up in, and we filled it. So I always just say, believe in the impossible. There are resources out there. We just have to find the right resource to implement to get you there. And it's going to look different for everybody, but it's a team. It's meant to be collaborative. Everybody has good ideas, and usually the best idea comes from the patient or the family member. So don't feel like you don't have a voice, and speak up and speak loud, so that we can accomplish things that people think are impossible, like running a marathon a year after a pica bypass.
Exactly. Well, all I have to say is that, as you mentioned, you wear a lot of hats, and gosh, that's pretty amazing in its own. But I have to say that to just continue on with what Cherise had said, that she's there, she's willing to show up. Not only did she show up, she showed up and not only for that extra mile, she went an extra 25.2 miles for me, and that just means I cannot say enough. I mean, I don't think words can ever describe or is enough for Rob and I to say how much gratitude we have for you and Dr. Mack, Dr. Russin, and all the medical staff at 7 South. And again, it's just a testament to who you are and the fact that I'm 8 years out from my brain aneurysm, and we're still connecting. So it's just a testament to who you are. You will, always be there for me. And I love you for that. Thank you so much.
I love you too.
And you're doing such great things. And I'm just waiting for that day where you're like plastered on a magazine of the most badass doctor PT, and I'm like, I know her. I know her. I was the child of the blueprint that she created. And that's where I am right now. So again, thank you, Cherise, for taking the time. We're not going to tell the listeners of how we got here today.
Oh, man.
That's another podcast of its own.
Right.
It's funny. But it's a treat. It's a treat to see you in person, sort of.
I know.
To talk to you.
So good to see you both. And like I said, I really appreciate the opportunity to, have this conversation and to share my story and, reflect the impact that I had on you. But Kathy, you need to recognize that you have impacted more people from being vulnerable to share your story and create this platform. And it's just been really cool to follow along in your journey and see how you've expanded from the fundraising to advocacy to you now kind of being a pillar for others starting their journey of recovery. So kudos to you. And I really think it's phenomenal what you two are doing. So keep it up, and definitely cheering you on and always willing to partner and support in any way that I can.
Thank you.
Yes, thank you so much.
We Run With You is a nonprofit with a mission to improve the lives of people suffering from brain injury and disease by funding research, raising awareness, and providing support for survivors and their families. Find out more at werunwithyou.org. Thank you so much for joining us today. If you enjoyed this episode, please subscribe and leave a comment or review. Until next time, keep doing good.